Assalamu alaikum wa rahmatullah. My name is Nasreen Usama Khadir, and my roll number is 13 series 109, and I'm doing the assignment of 602. The assignment handed to me was the treatment of the biliary tract infections. And as we know, for the introduction, biliary tract infections are characterized by two inflammations, which are the cholecystitis and the cholangitis. So the cholecystitis, which is the acute inflammation of the gallbladder, and the cholangitis, which is the inflammation of the bile duct. Both these inflammations are characterized, especially in this type of the infection, which is the biliary tract infection, and the symptoms of these infections include the jaundice, which is the yellowing of the skin, and also involves the whitening of the eye. Abdominal pain could also be included, nausea and vomiting, fatigue, chills and fever, itching, and discoloration of the urine into light brown or sometimes even dark brown. The reason or the etiology for the biliary tract infections varies, but the most important reasons include autoimmune disease, also the blockage of the biliary tract, gallstones could be a main reason also, and the bacterial infections also, because at the end it's the bacterial, it's a biliary tract infection. So the case study that was handled to me was DS. A 42-year-old man was presented to the hospital with a 2-day history of abdominal pain and tenderness localized to the right upper quadrant. Fever was high, 38.9 Celsius, and he was feeling chills. He complains of nausea, 3 episodes of vomiting, emesis occurring in the past 24-hour day. It was also appearance of jaundice, which is the yellow coloration, and also discoloration of the urine into the dark color. His laboratory value of the WBC's count was 15, 1.3 millimeters, and the serum creatinine level was 1.2, which was high. Total bilirubin was 4 mg, which was higher than the normal, and the alkaline phosphate was very high. So, what was the evidence of the cholangitis existing in this patient, and how does the presentation of cholecystitis differ from the cholangitis? How we can actually diagnose if this patient is suffering from cholecystitis, which is the inflammation of the gallbladder, or cholangitis. So first, we're gonna start with the soap. First things first, which is the S subject. The patient is 42 years old. He's male. The location of the pain was abdominal pain. Duration, he was suffering from this pain for 2 days. The history was he was present in the hospital with 2 days of history abdominal pain. He was feeling tenderness, fatigue, and the fever is very high also. He had nausea, and they already had 3 episodes of emesis and vomiting in the last day. The objective, which is the symptoms that the patient was suffering from, he was admitted to the hospital. Fever was very high. He was feeling chills. He had nausea, also vomited. His eyes were yellow, and there was discoloration of his skin and urine also. And this discoloration could be a sign also of a liver disease. After getting his results done from the WBC, the count of white blood cells was appeared very less than the normal range, which showed that he had a leukopenia, which is decrease in the white blood cells count. With the diagnosis of the liver disease and white blood cells, it appeared that the patient also had a thrombocytopenia, which is decrease in the white blood cells and also plasma. The sign the A in the SOAP, which is the assessment, how we can diagnose this patient's disease. The sign of fever, chills, and jaundice, which was a clear evidence, sorry, for the cholangitis, which is existing in this diagnosis. The cholangitis, which is, as we said, is the inflammation of the bile duct. Uh, there are reasons that we know that this inflammation in the cholangitis was present also because of the bilirubin level, which was above the normal, and the alkaline phosphate level, which was 22 units per liter, which was also above the normal level. This is the reason that we could differentiate between the two inflammations which was related to the biliary tract infection. The patient was suffering from cholangitis, not cholestasis, which is the gallbladder inflammation. There was also a kidney malfunction because the creatinine value or the creatinine increase was 1.2 mg per deciliter. So the plan, which is the treatment that we are giving to the patient, patient could be given a urodozole. Urodozole is a drug which helps in destroying the gallstones, uh, which is the main reason also, which could be which causes this kind of inflammation, and it will destroy the gallstones and it will inhibit its formation also. At the same time, patient also could be treated with the penicillin derivatives such as piperacillin or even cephalosporins such as ceftaxime, as it is also an infection. Uh, so the infection treatment will be an antibiotic. Methotrexate also could be used, but with caution because in some patients it causes severe adverse effects such as diarrhea, nausea, faintage, and it also could cause the decrease in white blood cells count, which in this case the patient is already suffering from a low WBC count. As a plan, a further laboratory test could be done to assess whether the liver function is going correctly or no. The biochemical liver test could be done, uh, which is in this point very crucial as the discoloration of the patient shows that he has a jaundice, which is related directly to the liver function. So elevated level of biochemical function of the liver should be also tested. And CBC also should be conducted so that the infections can be ruled and monitored. It is important to rule out infections in the patient because they could lead to worsening of his condition. Also, it is important to manage the infections with the right medication from the first place so that the right diagnosis of the patient and giving them the right treatment is quietly very important. Thank you very much. This was my presentation for this case study.